If you care about your health, your confidence, and your future, this video is for you. I'm Dr. Laura, a urology and men's health expert. Today we're going to talk about 10 things you should never do to your penis. These aren't just warnings, they're important tips to help you stay safe, healthy, and confident in your sex life for years to come. So let's get started. Don't ignore your penis. Number 1. Don't ignore your penis. Your penis is a strong sign of your overall health. Studies show that men who develop erectile dysfunction are much more likely to have a heart attack within 7 years. That's because the blood vessels in your penis are small, so blood flow problems often show up there first. Good erections mean your circulation, hormones, nerves, and mental health are all working well. If you notice changes, don't brush them off. Pay attention. Don't try home remedies. Number 2. Don't try fixing problems with risky home remedies. I've seen men use everything from apple cider vinegar for growth to homemade gadgets made of plastic bottles and metal rings. Please don't do this. These methods can cause serious damage like nerve injury, scarring, or even lifelong erectile dysfunction. One common example is jelqing, stretching the penis by hand to make it longer. This often causes tiny tears in the tissue and lasting harm. I've treated young men with permanent issues because of this. Another danger is using makeshift constriction bands. I've had patients end up in the ER after using bottle caps, metal nuts, or rubber ties they couldn't remove. Some even needed power tools to get them off. If you use a ring, choose a medical one that's easy to take off. Keep your penis clean. Number 3. Keep your penis clean the right way. This sounds simple, but it's often ignored, especially by men who are uncircumcised. If you have foreskin, gently pull it back, wash underneath, and dry the area. Skipping this can lead to a buildup of bacteria and skin cells called smegma, which can cause infections, swelling, or even the skin sticking together. There's also a link between poor cleaning habits and penile cancer. It's rare, but if you can't pull back your foreskin or never check the skin underneath, you might miss early warning signs. That said, don't overdo it with scrubbing or harsh soaps. The skin there is sensitive. Use mild soapy water, rinse well, and pat dry. Avoid strong scents or rough washing. Don't ignore pain, bleeding, or changes. Number 4. Don't ignore pain, bleeding, or changes. If sex or peeing hurts, or if you see a lump, sore, or blood in your urine, don't wait. These could be signs of a UTI, an STI, kidney or bladder stones, or even cancer in rare cases. I know these things are uncomfortable to talk about, but catching problems early makes all the difference. If your doctor makes you feel embarrassed, find one who doesn't. You deserve care without shame. Stay in control and be safe. Number 5. Stay in control and be safe during sex. Nothing is more attractive than confidence and safety. Using protection doesn't just prevent infections, it also helps you relax and enjoy the moment without fear. Safety also means being careful with movement. Penile fractures are real, and they're serious. If your hard penis bends suddenly during rough sex, especially from hitting the wrong angle, you can tear the outer tissue. You'll hear a pop, feel sharp pain, and see swelling or bruising, what doctors call eggplant deformity. If this happens, get to the ER right away. Quick surgery gives you the best chance at recovery. Waiting too long can cause permanent problems. And yes, use lots of lube. It reduces friction and lowers the chance of injury. And remember, losing lubrication doesn't mean your partner isn't turned on. It can happen because of hormones, medication, or even stress. Lube helps everyone. Number 6. Don't overheat it. Your testicles are outside your body for a reason. They need to stay cooler than your body temperature to make healthy sperm and testosterone. Avoid spending too much time in hot tubs or saunas, resting a laptop on your lap, and try to keep your phone out of your front pocket when possible. These habits can affect sperm health and hormone levels over time. Number 7. Be gentle when you masturbate. Using too much pressure or gripping too tightly can make your body less sensitive to normal touch. This is called death grip, and it's one of the most common reasons for low sensitivity and delayed ejaculation. If solo play feels better than sex with a partner, that's a sign your technique may be too rough. Change it up. Use lubrication. Slow down and retrain your body to respond to different sensations. Number 8. Don't smoke, and take care of your body. Smoking is one of the fastest ways to damage the blood vessels in your penis. It's directly linked to erectile dysfunction and raises your risk of bladder cancer, one of the hardest cancers to treat. Your lifestyle matters. Eating healthy, exercising regularly, and managing stress can protect both your erections and your life. Cardio exercise improves blood flow, strength training supports testosterone, and cutting down on alcohol, avoiding drugs, and sleeping well all help your sexual health. Number 9. Be kind to yourself. This might be the most important advice. Men often tie their self-worth to sexual performance, but everyone has off days. If things don't go perfectly, don't panic or beat yourself up. Stress and anxiety can make it worse next time, creating a cycle that's hard to break. Your body isn't a machine, it's human. Talk to someone you trust, or reach out to a doctor. You are not alone. And finally, number 10. Use it or lose it, sort of. If you stop getting erections because of stress, relationship struggles, or health problems, your body can start reducing blood flow there. You might lose sensitivity, notice some shrinkage, or develop scar tissue. Nighttime erections are your body's natural way of keeping your penis healthy. If they stop completely, it can mean something deeper is wrong. Sex and intimacy are important for pleasure, connection, and overall health. Even occasional stimulation, alone or with a partner, helps keep blood flowing and tissues strong. So yes, use it, protect it, and respect it. If you want a natural way to support stronger erections, I recommend trying our watermelon supplement linked below. It's made from watermelon extract rich in L-citrulline, which your body turns into nitric oxide. This widens blood vessels and improves circulation where it matters most. It's gentle, stimulant-free, and designed for men who want better blood flow without relying only on prescription drugs. You'll find the link in the description or pinned comment. Take care of yourself. You deserve to feel confident in your body. I'm Dr. Laura, urology and men's health expert, and my goal is to help you feel informed, confident, and empowered at every stage of life. If this video helped you, share it with someone who might benefit, and always remember to look after your health. You are worth it.